one may say that you are as old as your microbiome. Could you develop a bit on that topic?
Yeah, definitely I can agree with that sentence, because as I started working with microbiome, we found that not only in the purposes of antibiotic decolonization, immune tolerance, etc., we can use the microbiome, but people who are using fecal microbiome transplant, and this is reported by the doctors we collaborate with, reports that the people are getting better, just, stand from the ICU departments, etc. And we started some time ago longevity healthy aging program, when we are aimed to reset the immunological age and mostly epigenetic ages, because I think this is the most important with microbiota and our cells, commitment and compartment. And definitely we can predict your age, your biological age, via the microbiome sequencing and then AI algorithms. This is what we do, and I hope we deliver the first biosynthetic biotherapeutic in that indication.
So you are in an area of 4P 3.0 medicine, predictive, personalized, preventative.
Yeah, and we are also called, in the microbiome area, we are also called Microbiome 3.0 company, because we strategically didn't register donor-derived, fecal-derived microbiome. We are using AI to, compute what particularly functions and genes should be in the drug, and then we are synthesizing multi-strain, full ecosystem restoration therapeutics. So we are personalizing our therapy towards particular condition on disease. And right now in the longevity space, delivering this biotherapeutic, we wanted to, this is not only for healthy aging, like we need to postpone the date when you will be mentally disabled and you need institutional care, because this is also already funded and on topic, but people just want to rejuvenate, want to be young. So we are also doing this for longevity purposes, and the top of the top will be to strictly personalize after this therapy, if something will be still lacking, to give you that what you really need. And this is what we do because of all the multi-omic and high throughput technologies we have.
And you have selected super donors, so I may say superhumans, human gods, basically. People who has the healthiest, the most desirable microbiome. So how many of them you have? How many samples you have already selected? What's your biobank size of?
Yeah, indeed. We have, screened 220 or something super donors. Why we are called them super donors?
But 220 seems not too many.
Yeah,
how many of them you have tested?
We have screened several thousands of people, and positive
After preselection.
And positive success rate is 0.5% of people who want to become a donor becomes a donor in real life, and those who have those particular phenotyping features in the microbiome, genes, content, etc., it's only few from all of those donors we corrected. So this is 0.001% of really healthy super donors who has biological age or different metrics lower than metrical age.
And I may just use this comparison, and this top of the top, so those gods from the Olymp.
Yeah.
So you have several of them?
Yeah.
10, 12?
Yeah, like several, 10, 12, dozens maybe, such donors. And we are using them also in the near future in our clinical study within longevity space to decrease the biological ages. And we've collected over 40,000 samples, biosamples from healthy donors and patients being treated with microbiome transplant. We are now computing the biological ages, what is decreasing the methylation age, etc. And all of those interactions with microbiome, multi-omic sciences, AI will go us through the synthesizing the first biosynthetic microbiome for longevity and well-being purposes.
Understand. So using this FMT, fecal microbiome transplant, you influence the innocence cells, then oxidation level, inflammaging level, and you can eliminate or decrease some of those parameters, right? Or cells.
So basically, as I'm a physician hematologist, we work firstly to combat antibiotic-resistant bacteria, to lower the infections rate, etc. And this is also communicated with our immunology. So we work to, silence the immune system. And these observations make that we are trying to influence the inflammatory age. So this means we can decolonize, get rid of some bacteria which stimulate pro-inflammatory cells,
right.
And mostly to change the methylation age, because epigenetically bacteria with our colonocytes and then immunocytes are changing the methylation path, and there are these are two mostly involved ages in our biology, which most of other clocks are connected with. So these two parameters we think could really shorten your biological age.
So now you are going to have a round and fundraise money mostly for wet lab and bioreactors, right? To produce the biosynthetic bacteria.
So we've created 3 parts of the company, and the 4th part is already being scheduled, and all the concept is made. So we are just waiting for rising this round and go into it to finish the very high throughput and very deep tech laboratory to synthesize the first dose, the first batch of the drug. And this is what we are looking for in investor space right now. And this will be probably the first biosynthetic microbiome in the world, and in the longevity and healthy aging space, this will be definitely the first one which will replenish the full microbiome ecosystem with all of those beneficial features in bacteria which are influencing our biological age.
So you have a signature, and these are the super donors selected, and you have a simple. You have a human being here, and you are saying we are moving you towards this ideal signature. And we can do it via those biosynthetic new generation drugs.
So you are forcing me to disclose some science.
Just in general.
But so we have this signature of super donors. We've computed that they have all of those metrics. We compute necessary to achieve healthy aging and longevity purposes. We are comparing into centenarians, very old people and their families. There are some connections, and with really people who are longevity oriented and already have biological age lower than metrical. All of our algorithms then compute what particularly should be transplanted. So what functions should be transplanted to the persons who want to achieve this longevity well-being purposes. And yes, right now we are entering the lab to synthesize those particular multi-strain consortia which has encoded the longevity property.
And maybe very now popular thing is, your emotional health. And microbiome is responsible for the production of 80+% of dopamine and 70-80% of serotonin, if I'm not mistaken. So I understand that you are not afraid that with this fecal microbiome transplant, you can transplant also happiness. Okay, so I wanted to say depression or whatever, but I understand that you are rather pointing into the transplantation of this happiness, and you can influence instead of months, years of being on drugs, you can just change it relatively quickly comparing to the
and this was
medicine to zero.
Yeah, this was the very first observation after I, did a first fecal microbiome transplant, that after FMT people are healthier, are happier, and they got better. I thought that maybe they thinking this is just went, I'm off, transplant is good, but no, they just had really boosted the neurohormones, like you said, neurotransmitters, and we know that much more neurotransmitters are produced by bacteria than the other cells, and of course, in our questionnaire to select the donors, there are many questions about mental health, depression, etc. We exclude any people who has any of, let's say disability. Even mood is very important. And this is also what we think to this property should have our biotherapeutic, because not only rejuvenating people, but prolonging the time when you will need the institutional care, or somebody needs to care about you because you have amnesia or dementia. This is very big market already invested in. For example, Netherlands, Denmark. I heard that governments funds the therapeutics and interventions to prolong your healthy living, because for the economy, this is like 5 times more you generate if you stay 1 year at home than in 1 year in institutional care. So both of them, to rejuvenate people and to stay with good mental health, will have these properties in our biotherapeutics.
You have this fantastic results comparing to the antibiotics with the elimination of this bacteria.
Yeah, so the disease like Clostridium difficile infection, so very severe gastrointestinal infection with mortality rate over 30% even. This is the first official indication to use microbiome therapies and transplants, and we are distributing our products to hospitals in Poland, and we are tracking the success rate of treating these patients. And we have 91% of success rate treatment. So comparing to the best antibiotic costs, several $1,000, it's 50% success rate, and the standard one in 30%. So 91%. So via the microbiome is something really enormous.
A fraction of a price and multiple of the success ratio.
Yeah, and
compared
this is
to antibiotics.
Totally known that this is the most effective therapeutic. So I hope this is the future, and already there are 2 registered drugs in the market to treat C. diff.
I understand that just to make a resume, with FMT, you may transplant happiness, health, and longevity.
Looks like science fiction, but yes. And this is totally scientifically backed and proven that not only gastrointestinal diseases could be treated with microbiome transplant or therapeutics, but also your mental health, your immune system, and others. So this is the blockbuster in the future to treat with the microbiome many diseases and conditions you may even not think about.
You know that this therapy has been known for thousands of years. And in
4th
China,
year before Christ, Chinese golden soup.
Exactly.
Yeah.
This famous golden soup.
And then in 1958, there is the first scientific report of using fecal microbiome transplant in surgical patient in the U.S. to treat very severe Clostridium difficile patient. And this is the modern era. But as we told, Chinese use those fecal transplants many years ago, and as it was
to describe it, they were giving soup with the
poop,
poop of a healthy person, right?
Yeah.
Bon appetit.
And they eat it. So ate it. They ate it. So this is very well known therapeutic, but And now the new standards, the new technologies of sequencing enabled us to look what is really working with this FMT and to humanize this therapy.